think there are a lot of things that we do to alter people because we haven't gained experience or learnt, that the way we treat them isn't going to be the same outcomes as the way we treat normal adults. Putting a catheter in someone to measure how much urine they're making is important in patients who are very sick from an infection, for example, or kidney failure, who you're worried about their kidney shutting down, and you need to know early so you can get them somewhere where they're going to have their kidneys replaced with a dialysis machine, for example. But the majority of geriatric patients, a lot of them may not be for that treatment if that were to happen. But even if they were, the reality is the NHS is so busy and understaffed. I can't remember the last time there was an accurate measuring of urine output, for example. And, you just can't rely on those things. And there are other ways. Who says you need to put a catheter in someone? If I get someone to wee into a bottle, we can weigh that. If they're incontinent and they're wearing incontinence pads, we can weigh the pads before and after and know how much urine they made. It's very simple. We're just so used to writing down medical plans without thinking about the person on the other side. We treat the illnesses, not the people. That's the problem. That's what the difference between geriatrics and normal medicine is. It's not treating the problems, treating the patient. Putting a catheter in, if they're confused, they may pull on it, cause trauma, cause bleeding, increase the risk of infection. And that could be the turning point in whether or not someone lives or dies. Just that one event could be enough to kill them. So yeah, that's why geriatrics is so interesting. It's about being brave enough to do something that seems wrong and knowing that you can justify it and explain why. And then actually the best doctors will involve their patients in that decision. I go to the patient and, assuming a compass metis, explain why I may want to put a catheter, what the risks are, what we stand to gain and lose from it, and let them decide. That's what we really should be doing.